The Imperial Valley's AM 1230, KXO El Centro, California. Well, as has been our custom for the last 8 years, 7 months, and 42 days, we are visiting with folks from Imperial County and getting updates on the COVID-19 pandemic. It is 8 years, isn't it, Janette?
It very much feels like it.
Okay. We're going on, 4 months plus?
4 months plus when the COVID activity kicked off for the Public Health Department. We've actually been working since the last week of January. So for us, it's closer to 6 months.
Okay. And I should say on the phone with us today, Janette Angulo, the Public Health Director, and also with us today, Veronica Rodriguez, Director of Social Services for Imperial County. And good morning, ladies. It's another beautiful day in the neighborhood.
Good morning. It sure is.
Okay. Well, we got to make the most of it, right?
Absolutely. It is beautiful today.
Okay. Let's start off with Janette. Dr. Monday issued an amended order for Imperial County and kind of took us back to where we were when we started, right?
That is correct. Some decisions had to be made earlier in the week. But before I go over what those modifications are, I want to provide some context of what drove us to head that way. In just 2 months, Mr. Buckley, we've had over 500 COVID-positive patients transferred out of Imperial into other California hospitals. What we're seeing throughout California now is many counties, when they did their reopening and a couple of weeks later, they started to see an increase in cases again, and with that, increases in hospitalizations. So other counties have their own issues when it comes to hospitalizations. Coming back to our patients transferred, they continue. We continue to have transfers on a daily basis. We also have the highest case positivity rate per 100,000 population in California. We are currently at 706 over the last 14 days, and that's close to triple to what LA has, and that's a county with over 10 million people. Unfortunately, we've lost 100 members of this community, and several deaths are currently being investigated. Our hearts truly go out to those families who have lost a family member or a friend. And one life lost, Carroll, is one life too many. And those are just some of the factors that drove us to that direction, like I said. And so, yes, going back to that health officer order that was amended, it included a couple of actions. Non-essential retail businesses, as they are to be closed. That's closed to in-store shopping. They're still allowed to do curbside pickup only. Religious services, indoor services are prohibited. Outdoor services are allowed, but the maximum is 100 participants. And as long as they can implement social distancing measures and they have those site-specific plans in place. County parks are closed. And we are highly encouraging cities to close their parks as well. Now, what was happening is we were seeing quite a bit of individuals mixing from different households at parks, playing soccer, playing basketball. And so that's counterproductive to what we're trying to do here. The new amended order also reiterates a few things that we have already had in place. For example, the stay-at-home order has not been lifted. It was limiting trips out only for essential tasks and activities. Families are strongly encouraged that only one person goes out and does the essentials instead of the whole family going out to, for example, getting the groceries. Face coverings are still required for all residents. Let's keep in mind that children under 2 face coverings are not recommended, as well as for individuals with certain conditions, for example, respiratory conditions. Those are not recommended for them either. And then just the general practicing social distancing, physical distancing, staying home when you're sick, telecommuting for those employers. If telecommuting is an option, grant those to your employees. Washing your hands, essential. Please wash them frequently. And then one last thing, non-essential gatherings are prohibited of any size. So those are just a summary of the changes in this new health officer order.
And let me go to the non-essential gatherings. And it's one of the things that you see it in your neighborhood. All the family comes over. Well, they're family. It's important that we get together. That part I understand, but they don't live in the same household. That's an issue.
It is a great issue, Mr. Buckley, because this is what we're seeing in our cases. We have one individual in the family getting infected, and then we see 2, 3, 4, 5 or more people within that family getting infected. So that is an issue.
And it's tough because I understand the importance of family, but it's one of those things that you really should stick with. And I've got to mention the city of Mexicali, not the federal government, not the state, it is the city, has been doing what they are referring to as sanitary checks of folks that are going into Mexicali. And that I applaud the city of Mexicali for doing that, because it's going both ways. The COVID-19 doesn't know a border fence, and folks from here are taking it there, folks from there are bringing it back. I applaud the city of Mexicali for doing that.
And you bring up a very important point, Mr. Buckley, because, these are tough times. These are truly tough times, and sometimes we're inclined to pointing fingers and who is bringing the virus to us. But we are a unique county. We are bordered by a country, by a state, 2 huge counties. And if we look at our activity, those sanitary points going into Mexicali, last week, I'm not sure this week how long the wait was, but that gives you a sense that, some of our Imperial County residents are going across the border either to seek care, to go home, that's where they live, or do some other business. So we have traffic going into Mexicali. We also have traffic coming into Imperial County because we have essential workers. We have United States citizens or those with some legal status come in to seek health care and other services in our community. Now, we also have individuals that travel to Yuma, to San Diego, to Riverside because of work or because that's their home or vice versa. So we have quite a bit of mobility in our community.
You're right. The very transient in moving around to the east in Arizona, where until very recently there were almost no restrictions. San Diego, which has had loosened restrictions and then started to clamp down, by the way. And also, I don't know if you are aware, but it is pretty much bumper to bumper zonies heading to San Diego for the Independence Day weekend. And that they're in for a big surprise when they get to San Diego and find, they've shut things down again. So people are very mobile, and the virus goes with them.
And there's community spread. It's community spread. So you may go out and you may catch this virus anywhere. So So we just need to be careful, take the needed precautions. Prevention is key here.
Okay. Now, we don't want to forget Veronica. I've got a couple of questions, Veronica. First off, a couple of weeks ago, they moved some travel trailers into the Imperial County Fairgrounds and set up a little area for homeless. Is that being utilized? What is the status of that right now?
Absolutely. Good morning, Mr. Buckley. What I wanted to let you know is we have been utilizing them every day since they were installed. We do have them at the IB Expo. It is our project homeless housing. What this project does is it houses all COVID positive homeless that are willing, because our program is voluntary, that are willing to stay within actually follow the isolation order that public health issued. So what it does is it's 10 travel trailers. We do provide under this program intensive case management, so we do link them to any other basic needs that they have, whether they're medical, whether it's transportation. We work with other agencies if they have continued services through other providers while they're in their isolation period at the trailer. What we also provide that population is also nutritional meals. As you know, they're in isolation, they're homeless, and they cannot leave the site. And so we do make sure that they have nutritional meals and coordinated services. What we can through their isolation period is we start planning for transition for them to leave. To date, we have housed a total of 17 individuals into this program.
Okay. Now, I have to ask, okay, Kxo studios are located downtown El Centro, and the transient population downtown, I hesitate to call some of them homeless, though they are homeless. It's often their choice because they have mental issues or substance abuse issues. It seemed at one point they were being housed somewhere else, but it appears now they are back in the downtown area. Are the vouchers still available? Is this issue still being addressed?
It never went away. Let me tell you what we have with our programs. We divided it into two, and the first one is that Project Homeless Housing for the COVID positive. The other program is Project Safeguard. What we have to do, because of the volume and the limited resources we have as a county, we've had to prioritize the homeless population. So part of our priority is our COVID positive individuals. So we need to make sure they don't spread COVID-19 among the community. So we have them contained within our project housing, right? So then we also have to follow our next priority list, which is those homeless individuals that are exposed to COVID-19 or the ones that are high-risk individuals. And these individuals are the ones that are 65 and older or have underlying medical conditions. We prioritize those two populations. The vouchers never went away. What we ended up doing is we organized the voucher system. We do have a agreement with one of the hotels where we do house this priority population. We want to make sure that the ones that are more at risk or more exposed to spreading COVID-19, that those individuals that have the ability to shelter in place. What we also have is those other homeless, or the additional homeless that don't necessarily meet this criteria but want to shelter in place. Anybody who calls our homeless hotline, we do link them to existing available resources to house the homeless. So we have been moving forward with this. I can tell you that to date in our hotel, it's called Project Safeguard. In our hotel, it is 36-room occupancy. We provide basic management, case management services and linkages for other services as well. To date, we've housed 44. However, since it started, through our homeless voucher system, we have housed a total of 270 individuals in hotels, through hotel vouchers in the county.
Okay. And I have to shift gears a little bit. Not only are you dealing with this now, but you're dealing with the devastation of the fire in Nyland Sunday. And you're still active in that, right?
Absolutely. We have had a very good response team for the county. We are actually, anybody who was displaced, we screened, we provided them with temporary housing through the hotels, depending on the program that they qualify for. But I can tell you that one of the wonderful state programs, supported programs that we have is those individuals that are eligible to CalWORK, they're able to obtain additional services through our social service department in obtaining housing and any other necessities that they have. Also individuals who, or those families that were CalFresh recipients, because of the emergency, were able to reload their EBT benefits so that way they can access them. And then there's other efforts through the county that we have put together to provide any other incidentals that they may need.
Okay. And back to Janette, okay. The Social Services Department addressing multiple issues. Gee, just when you thought it was safe, West Nile virus rears up again, right?
That is correct. So yesterday, we sent out an additional notice because our environmental health department, they have traps around the county, and we're always checking to see what kind of diseases are out there, and we want to make sure our community knows immediately. So as soon as those reports came in, we notified our communities that, St. Louis encephalitis is out there in mosquitoes, and so is West Nile virus. Good thing we still haven't had reports of human cases.
Okay.
So the St. Louis encephalitis and West Nile virus were found in mosquitoes, in some mosquito pools in our community.
And I have to ask this question from PETA. You're trapping mosquitoes. I certainly hope you're not using the leg hold traps.
I haven't seen the traps myself. That would be a question for vector control.
Okay. We'll bring that up. Okay. Ladies, did we miss anything?
Well, I just want to say one last thing, Mr. Buckley. Our success as a county and as a community depends on everyone. We all need to do our part. Yes, the public health department does its part, but we need every city, every community member to follow the health officer orders and force them. We need businesses to help us with these mandates and to ensure that their employees and clients are wearing face coverings, washing their hands, that their employees are telecommuting if possible. We really need every community member to wear, again, face coverings, practice social distancing, and avoid large gatherings. We truly, truly understand that these are great sacrifices that we are asking of people. But the situation we are in, it's completely necessary that we take certain steps. And we must take these together. We're trying to do everything possible to prevent anyone else from losing a child, a parent, a grandparent, a friend to COVID-19, Mr. Buckley. We need to come together and move forward as the strong Imperial County community that we are.
Okay. Ladies, I appreciate the visit. Janette Angulo, Public Health Director for Imperial County. Veronica Rodriguez, Director of Social Services for the county. I appreciate the visit. Maintain facial coverings. As we say, if you leave your place, cover your face. Maintain social distancing. And celebrate a safe and sane 4th of July. Have a great weekend, ladies.
Thank you. You too.
Thank you.
The Imperial Valley's best oldies on the radio.
It's what I listen to.
Oh, little girl, side.
Let freedom ring. It's our salute to Independence Day.
It makes you proud to be an American.
As we celebrate America's birthday with a special 3-hour presentation produced by the CBS Radio Network and hosted by Gil Gross. There will be stories of little-known heroes who helped build our great nation. There will be fun facts, historical insights, July 4th cooking tips, and of course, how to stay safe in the COVID-19 world. Let freedom ring. Listen Friday evening from 6 till 9, Saturday from 7 till 10 p.m., and Sunday from noon till 3. Celebrate the 4th of July with us on AM 1230.